Hey everyone, welcome back to all my listeners. This is episode 11 in season 18. Today is Wednesday, August 19th, 2026. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys. Well, did you know there is a huge update in the obstetrics and gynecology space? There's a major coding and major guidelines overhaul that I wanted to showcase in today's episode. Effective January 1st, 2027, the American Medical Association, that's our AMA, is replacing the decades-old bundled global obstetric package with the maternity phase specific CPT code set. So those of us who have been billing and coding for our various practitioners in the obstetrics and gynecology specialty, we have been used to the global obstetric package for years. So in my opinion, this is going to be a welcome change, but there's a lot for us to understand, read, and digest. And so I'm very grateful that the AMA right here in downtown Chicago has disclosed an early release of all of the work that they have been doing over the past couple of years. Now, this overhaul deletes about 17 codes, adds 12 new codes, and revises 6 existing codes to separately report antepartum care, labor management, delivery, and postpartum services. Now, in general, I wanted to just quickly provide a rough outline of the main updates. Now, there are key structural changes, and I will try and highlight some of the code-specific guidelines that the AMA has released. There are multiple documents that I recommend you guys go ahead and get on the AMA website and navigate to the new maternity care services page and all of the various links that you can click on and download the various PDF files. Now, key structural changes involve antepartum and postpartum care. All traditional global antepartum and postpartum bundles are deleted. Individual visits will now be reported using standard evaluation and management, that's our E&M, types of CPT codes for office and outpatient codes. Now, there's also a key structural change for labor management. New daily calendar-based codes distinguish between straightforward and complex care management. There's also key structural changes for delivery services. There are more streamlined vaginal and cesarean delivery codes, and they are separated entirely from labor management services. Now, for specific procedures, there are new dedicated codes that are established for targeted interventions, including 3rd and 4th degree perineal laceration repairs, uterine tamponade, and post-cesarean hysterectomy, just for example. Now, there's also going to be a practice impact that will happen based on all of these new code changes and guideline changes. So for practice impact, there will be more transparency and team-based care. Now, this particular shift unbundles care to accurately reflect modern, multi-clinician, and team-based obstetric environments. So I love this new shift. It makes sense to me in the modern practices that have evolved over these many decades, right? There are multi-clinicians that are involved for maternity care services, and it's definitely team-based obstetric environments, especially if you yourself, I myself, have had a baby, and so I know that there are a lot of people involved when it comes to taking care of you and the baby, the fetus, etc., for all of the months that you are with child. Now, there's also operational transition. Now, OB-GYN practices and hospital billing systems must now transition encounter workflows and electronic health record, those EHR templates, away from the single global fees. So again, I stress they put this out, they meaning the AMA, released this information just now in the summer of 2026 in anticipation of everything taking effect on January 1st, 2027, per usual, right? All of the codes will take effect then. However, the preparation should be happening now to make sure that your practices and billing systems are up to date. Now, the AMA has published great information on their website, and I just wanted to quote, "To help the healthcare ecosystem prepare to implement these revisions and enable physicians to deliver the best care possible to their patients, the AMA is releasing the CPT 2027 codes for maternity care services ahead of the standard release schedule and providing early education and resources on the revisions to this section of the CPT code set, end quote. So exactly as I summarized, this is why they want this education out early, again, to help all of the teams across the country get buttoned up, squared away for the changes that will happen and become effective January 1. Now, antepartum care includes all evaluation and management E&M care of the patient and or fetuses prior to the onset of labor. All current antepartum care codes will be deleted and reported per encounter with an E&M code. As such, the E&M rules will apply to these as well. Changes facilitate real-world reporting of the E&M service based on the location of the patient, for example, the office, the hospital, or telemedicine. They also go into greater detail for labor management. For daily reporting, this is going to now be reported once per calendar date. There are codes created for initial and subsequent days. They are further divided into two levels, straightforward and complex. Facility reporting for initial day is reported once per facility admission unless there is another unique provider. Reporting is similar to existing guidelines for inpatient hospital care. Now, again, they go into greater detail for delivery. New streamlined codes for vaginal deliveries with and without episiotomy, vaginal birth after cesarean or a VBAC, and cesarean deliveries primary versus repeat. Codes incorporate delivery care only and are not dependent on performance of other maternity care components, like labor management. That's going to be reported separately. Now, new distinct codes are added for third-degree laceration or episiotomy repair. There's also a new distinct code for fourth-degree laceration or episiotomy repair. There's also a new distinct code added for hysterectomy following cesarean delivery, and that's going to be as a standalone code. And then, of course, they go into even greater detail for postpartum care. All current postpartum care codes will be deleted and reported per encounter with E&M codes in 2027. As such, the current E&M rules will apply to these as well. Routine postpartum care on the same calendar day as the delivery is incorporated in the delivery care code. For facility births, subsequent hospital care codes will be reported for each management day after delivery day until discharge. All right, now that was just brief information from their webpage. However, there's also a 13-page PDF file that I've been mentioning that you can download that provides all of the guidelines in green text. Again, green text because it is all brand new, as well as the new and deleted and revised codes. Now, let me just read to you a snippet of these new guidelines from maternity care services. Quote, maternity care includes outpatient and inpatient antepartum care, labor management, delivery care, and inpatient and outpatient postpartum care. Pregnancy confirmation during any encounter may be reported with the appropriate evaluation and management code for that setting, like the office or other outpatient E&M or preventative medicine services. For care provided by a non-physician qualified healthcare professional, QHP, who may not report E&M services, for example, those genetic counselors or those dietitians, refer to the specific service, like for the genetic counseling with CPT code 96041, or for your medical nutrition therapy with your CPT codes 97802, 97803, and 97804. Moving on, let me read to you a snippet from antepartum care. Quote, antepartum care includes the management of pregnancy prior to the onset of labor. Antepartum care is reported with the appropriate evaluation and management codes. All of those codes, again, from our office or other outpatient services, codes from our telemedicine services, codes from our virtual check-ins, codes from home or resident services, codes from initial or subsequent hospital inpatient or observation services, codes from hospital inpatient or observation care services, and finally, codes from critical care services. When the pregnant person is admitted to the hospital for other than labor management as an inpatient or to observation status in the course of an encounter in another initial site of service, like, for example, the hospital emergency department or the office, the services in the initial site may be separately reported. Modifier 25 may be added to the other E&M service to indicate a significant, separately identifiable service by the same physician or other QHP was performed on the same calendar date. Let me move on. Another small snippet from antepartum procedures and fetal invasive services. Quote, antepartum and fetal invasive procedures may be separately reported from antepartum evaluation and management services. Any diagnostic imaging services, including maternal pelvis and placenta, fetal magnetic resonance imaging may be separately reported in addition to antepartum E&M visits. Now, let me move on and talk about a little snippet from labor management guidelines. Quote, labor management involves integrated decision-making to assess, support, and balance the well-being of the patient, the pregnant person who is in labor or preparing for the birth, as well as the fetuses, including managing medical conditions or complications like cardiac or neurological conditions, diabetes, hypertension, preeclampsia, abnormal fetal heart tracings, and labor dystocia. The goal of labor management is to optimize patient and fetal well-being to achieve the delivery of the fetuses. Now, the AMA continues on in green text and discusses to report the highest level of labor management performed once per calendar date. For example, if labor management begins as straightforward, but during the same calendar date transitions to complex labor management, report only complex labor management for that calendar date. Now they go over the differences in detail between straightforward and complex labor and so much more. Moving on, I'd like to highlight delivery care. Quote, delivery care begins when labor is complete. Delivery care includes management of the patient and fetuses. Immediate, same calendar date postpartum care is considered part of delivery care services and may not be separately reported. When a patient is discharged on the same calendar date as delivery care, do not separately report hospital inpatient or observation discharge day management. When postpartum care takes place on a calendar date subsequent to the date of reported delivery care services, report the appropriate E&M code. Vaginal and cesarean delivery care do not include the work of labor management. Now, of course, there's so much more, but to wrap up today's episode, let me just touch on maternal postpartum care. Quote, postpartum maternal care includes ongoing assessments tailored to the individual patient. Postpartum care is reported as an evaluation and management service. Immediate, same calendar date postpartum care is included in vaginal and cesarean delivery. End quote. All right, you guys. Well, I hope you got a lot out of this very, very important update on maternity care services. There are new codes. There are many, many new guidelines in green text. So I can't wait to dive in, dig deeper, and advise my clients in this space to start working with their EHR vendors and start updating all of these materials into their charge masters, because things are going to be rapidly changing here effective January 1st, 2027. So I need to alert my clients that all of these changes need to start being implemented, and their teams need to understand what is going on with all of these massive changes from the outdated and old global packages that we were very, very used to here in this space for so very long. But anyways, you guys, I thank you so much for listening on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.